All right, good evening, everybody. My name is Dr. Shankar Narayanan, and tonight we're going to be talking about one of my biggest passions, and that is hip replacement. And we're going to be talking about whether or not you are a candidate for hip replacement surgery. So, I perform surgery at Christ Hospital, and that is in Mount Auburn, downtown at the Joint and Spine Center. The Joint and Spine Center opened in 2015, and it is one of the nicest hospitals around town. They have some of the largest operating rooms and some of the largest private rooms that have amazing views of downtown Cincinnati. The staff is excellent, and they take very, very good care of my patients, and they take great care of me, and they do an excellent job. They do well over 5,000 joint replacements per year at that hospital alone, which is the most in the tri-state area. So a couple housekeeping items, just so you guys know, everyone is muted. If you have any questions, comments, or technical difficulties, we will address all of those questions at the end. This is being recorded, and you will receive a follow-up email with a link to the recording in the event you want to go over it again. So with that, let's get started. I personally don't have any financial disclosures. I don't have any conflicts of interest, and this is meant to be educational. So a little bit about myself. I was born and raised here in Cincinnati, Ohio. I went to St. Xavier for high school, and then I matriculated for undergrad at The Ohio State University for where I got my bachelor's in biology. I actually moved back to Cincinnati for a couple of years between undergraduate and medical school and worked at Children's, and then got into medical school and went to Wright State University, just up 75 in Dayton, Ohio, and then went back to OSU for residency where I met my lovely wife. We then went to New York, where I did a fellowship specifically in hip and knee replacement and complex revision hip and knee replacement, where I learned from a guy named Roy Davidovich. He did the first anterior hip replacement in New York City and has subsequently done over 5,000 anterior hip replacements since. So let's get right into it. What is a hip replacement? A hip replacement is a surgery for anyone that suffers from hip arthritis. And hip arthritis is degeneration of the ball and socket. What we do, and we'll talk about this more in depth, but we remove the arthritic ball and we reshape or resurface the socket and replace it with metal and plastic. This is a picture of what a hip replacement looks like and the type of hip replacement I use in the operating room. So going through basic hip anatomy, what is the hip? The hip is part of the pelvis, and you have two hips, a right and a left, and it is a ball and socket joint. The ball or the head is here, the neck is here, and the femur or thigh bone is right here. When patients have hip arthritis, the ball gets degenerated and loses cartilage along with the acetabulum. And we'll get into some of the clinical symptoms in just a moment. So how does someone like you know if you actually have hip arthritis? Well, a couple questions that I'll ask you right now is, do you have any groin pain? Do you walk with a limp? Do you maybe walk with a cane in either the right or the left hand? Do you have difficulty putting on shoes or socks? Do you have difficulty sitting cross-legged, or can you not sit Indian style anymore? Is it really difficult to get up from a low stool or a low toilet seat, or maybe even a low chair? If you drive a sedan, do you have significant difficulty getting in and out of the driver's seat or maybe the passenger seat? If you answer yes to any of those questions, you may have hip arthritis. So what I do when I see patients in the office and I'm concerned about hip arthritis, after asking them these kinds of questions, we will do a physical exam. And what I have patients do is I have them get up and I actually have them walk in the hallway for me. I want to see how you walk. And I want to see if you're walking with a cane, if you have a limp, or if you have something called a Trendelenburg gait or leg length discrepancy. A Trendelenburg gait is where you basically have a quote hip drop on the opposite side because you have weakness of your affected hip muscles. Sometimes patients also have a leg length discrepancy because they have arthritic change in the hip. They lose the cartilage and their hip is, or their leg is actually a little bit shorter than their other leg. Some of the other things I do is I'll then have patients get on the examination table if possible, and I will take their hip through range of motion, and I'll determine whether or not range of motion causes them pain. More often than not, when I take a hip through range of motion that has arthritis, patients notice significant pain when I turn their leg in and out. Then we look at x-rays. We do x-rays in all of our office locations, and we get several different views of your pelvis and your hip. These are a couple of x-rays of the pelvis. The one on the right demonstrates significant right hip osteoarthritis with complete joint space narrowing with bone hitting bone, hardening of the bone in the top, and even cysts in the bone here. The left hip demonstrates a big bone spur here. If you look at this particular hip in this image, this is the patient's left hip, and this patient also has complete bone loss with massive spurring of the bone throughout here. These are patients that have hip osteoarthritis. So the question, are you a candidate for hip replacement? Once we do all of this, we talk about your life and your lifestyle. Is this truly affecting your ability to do your activities of daily living? Household work, walking, driving, sitting, sleeping. Is it affecting your ability to do the activity that you enjoy, gardening, spending time getting on the floor with your grandchildren? If that is the case, then you would be a candidate for hip replacement surgery. And so what we do is we talk about 5 things that are done prior to hip replacement surgery. Hip replacement's a big operation, and we need to make sure that you're medically safe to undergo surgery. So 5 quick things listed here. Number 1 is medical clearance from your primary doctor. They'll make sure that your heart and lungs are okay to undergo anesthesia for surgery. I then have you see a dentist to ensure that no infections from here go into your artificial joint that we do. We then get blood work at Christ Hospital and then do a prehab appointment either at one of our offices or your preferred physical therapist office. They'll talk to you about using a walker after surgery, transitioning to a cane, and some of the exercises that they want you to do after surgery. Lastly, you have an appointment 1 week prior to surgery with me, where I go over your history and physical, your medical clearances, all of your blood work to ensure that we're going to have a successful outcome, and any last minute questions that you or your significant other may have prior to hip replacement surgery. Let's talk a little bit about surgery itself. I do surgery via the anterior approach. I do that because it lends itself to a quicker recovery and outpatient surgery. It is a muscle sparing approach, meaning that we're able to make an incision and dissect between the muscles instead of removing any muscle. The B in ABCs is a bikini incision. I have transitioned over to a bikini incision because they have patients that have incisions within the groin crease tend to have better wound healing. People do like it for cosmesis as well, but the biggest and most important portion is that we're doing an incision along the normal lines of your skin, so it leads to significantly better wound healing. The last thing is cementing. And what I will do in my elderly patient population, especially elderly women that have osteopenia or osteoporosis, is I will put bone cement within their femur. This will prevent the bone from fracturing in the future. So what do we do in surgery itself? You are seen in the preoperative holding area where we get you ready for surgery. I talk to you and your significant other prior to surgery. You will come to the operating room, and that is where we do surgery. We put you to sleep, and then we put you into a special table that lets me do the hip replacement from the anterior approach. I'll make an incision and dissect between the muscles and remove the hip capsule around this portion of the hip. I then cut the bone with a bone saw here and remove the arthritic ball. I then resurface the hip and the socket specifically and put a new socket into your hip. The socket itself has a porous coating on the back of it that allows bone to grow into it. Then I'll put a screw to hold it in place and put a piece of plastic that acts as your new cartilage. Then we turn our attention to the femur portion, where we hollow out the femur portion and put in a stem. That stem is made of titanium, which has hydroxyapatite coating, or the same coating that's in bone, that allows the bone and implant to become one. Lastly, we put a ball on the tip of the stem and put the ball in the socket. So we go from this to this. Common questions in recovery. You are going home the exact same day after surgery. Believe it or not, we are able to do hip replacement the exact same day, and you are able to walk. You are able to put full weight on your leg. You have no range of motion restrictions. You're up and down steps on the same day, and you're starting physical therapy within 2 to 4 days. I see people at the 2-week mark, and usually by the 2-week mark, people have stopped using the walker. Some of them use a cane, some of them don't use anything or any assistive device, especially if they didn't use one prior to surgery. I then see patients at 6 weeks, and at 6 weeks, people are very pleased. Most of the time, people will return to driving anywhere between 2 and 4 weeks. Sometimes for a right hip, it takes 4 to 6 weeks, but at 2 weeks, usually for a left hip replacement, people have returned to driving. Obviously, they can't be on narcotic pain medication if you're driving. Some of the exercises that we have you do in physical therapy walking. Walking is the best thing you can do. Also using a stationary bike, squatting, doing some leg lifts, quad sets, and hip abduction. Once your wound is healed appropriately, we can get you back into the water and doing some water aerobics and swimming as well. So hopefully you guys all learned a little bit about hip replacement and whether or not you're a candidate. If you would like to schedule a consultation and discuss how we can best meet your needs for your hip pain, please call 513-232-2663, my office. My locations are in Kenwood and Westchester. Our Kenwood location is across from Jewish Hospital on Pine Road, and our Westchester location is on Union Center Boulevard next to Lakota West High School. We will now open the forum for Q&A. Okay, first question. Once it's determined that I'm a candidate, what does the timeline look until I have my hip replacement surgery? That's an excellent question. So that all depends on when you want to have surgery as well. Usually, the time frame is about 30 days from the time I see you and the time that you decide to have surgery to the time that we do surgery. It takes about a month to get medical clearance and any other cardiac clearance or dental clearance that you may need, blood work at the lab, and then come in and see me prior to surgery for your prehab and pre-op appointment. Next question. You mentioned recovery. Can you talk a little bit more about what that is like? Sure, absolutely. Recovery is obviously something we talked a little bit about and touching more on. Recovery is generally done at home and people do very, very well. It's a lot of walking, icing, taking some medications like Tylenol, meloxicam or a non-steroidal anti-inflammatory medication, and pain medication as needed to help with some of the pain. Usually, by the time people are 6 weeks out, they're very pleased that they did this. But it generally takes about 6 months to a full year to really fully recover from hip replacement to the point where sometimes people actually forget that they had a hip replacement. So another question, both of my hips need replaced. Should I or can I get them done at the same time? That's an excellent question. I did do my first bilateral hip replacement in March. I think that someone I do think that bilateral hip replacements can be done. However, it's on a very special and specific circumstances that I think it can be done. Bilateral hip replacement's a tough operation. You have to stay in the hospital afterward, and you probably have to go to a rehab center. I think that only in very special circumstances should they be done at the same time. In 90% of my patients, I would recommend, 95 probably, I would recommend them being done separately. Next question. I am a runner. Will I be able to run? The answer is yes, absolutely. The goal is to get you back to doing all activities that you like and enjoy. In my personal practice, that is paramount and something that I would like to see happen. Next question. I work from home. Is it important that I still take time off? Very good question. With COVID and with work from home nowadays, I think that the only thing that I would tell you is you probably shouldn't work and do important work while you're taking narcotic pain medication. I think it's important to not take any important phone calls or do any important live meetings while you're taking narcotic pain medication. The other thing about work is that it cannot preclude you from doing physical therapy. So if it's better to work from home or work around physical therapy schedules, that's totally reasonable. But it is very possible to continue working for home so long that doesn't preclude your ability to recover. All right. Can you talk a little bit more about what a patient needs to do to prepare for hip replacement surgery? Absolutely. Preparing for hip replacement surgery is, in my opinion, fairly simple. We talk a lot about this at our pre-op appointment, but what really needs to be done is you need to make sure that you'll have someone with you on the day of surgery. And you need to make sure that you have almost like a coach or a family member that can help you do things like get some food from the fridge every now and then, or maybe help you with your medications. Those are the things that you'll need after surgery. Next question. What type of patient would not be a candidate for hip replacement surgery? That's a very good answer. In my personal practice, any patients that don't have hip arthritis obviously would not benefit from hip replacement surgery. And then there are certain other medical comorbidities that can preclude patients from hip replacement surgery. Uncontrolled diabetes, morbid obesity, chronic infections, and overall poor general health and well-being would likely preclude patients from surgery. However, those are not hard and fast rules, and we work very hard and work well together with patients in order to get them the best care they need. Another question comes from another patient. How long does the typical replacement last? That's a great question. Pre-2000, hip replacements were probably meant to last 10 to 15 years. The plastics were the rate limiting step in surgical intervention. And nowadays, we do something where we cross-link the plastic so that they now are not the rate limiting factor in how long they last. Truth be told, we don't know how long they last, but the goal is hopefully the rest of your life, 25, 30, maybe even 40 years. Another question from the audience. Are there steps that can be taken to help prolong hip replacement? That's a great question. What I always tell my patients is if you get to a point where you feel like you are unable to do your activities of daily living or unable to do the things you like and enjoy because the pain is so severe, then you know this would be a benefit to you. However, there is no need for a hip replacement. A hip replacement is not life-saving heart or brain surgery. This is all up to you when you decide it's best for you to have surgery. Things that can potentially be taken to help you are some activity modification, walking with an assistive device in the opposite hand. A lot of people think you should walk with it in the affected hand. It's actually the opposite hand. Anti-inflammatory medication judiciously and daily, and simple exercises to strengthen the quadricep muscles. Couple final questions. I feel I'm relatively active. Once fully recovered, do I need to pull back my activities, or can I go steam ahead without concern? My goal is for you to go full steam ahead once you are fully recovered without concern. Walking, running, biking, hiking, I would like you to do all of the above. And finally, how quickly can I make an appointment with you? We do same day and next day appointments. You can always call to schedule at any point in time. excuse me, we will work you in. I think that's all for tonight. If you guys have any questions, please feel free to go to www.orthocincy.com or call us at 513-232-2663. Thanks and have a great night.